Shocking new study reveals FGM, a leading cause of death for girls in Africa. Time for action. Welcome to the Bold African Voice, BAV, where we tackle some of Africa's most pressing issues with critical analysis and a forward-looking approach. I'm Abdul Karim Kargbo, born and raised in Africa. In today's video, we delve into a shocking new study that reveals the devastating toll of female genital mutilation, FGM, on young girls across Africa. With FGM being one of the leading causes of death for girls in areas where it's practiced, it's time to confront this public health crisis head-on. Stay with us as we break down the findings, compare its impact across the continent, and discuss what must be done to end this harmful practice once and for all. Female genital mutilation, cutting, FGMC, remains one of Africa's most deeply entrenched yet harmful cultural practices, affecting millions of women and girls across the continent. A new study has revealed an alarming reality. FGMC is now considered a leading cause of death among girls and young women in countries where the practice is widespread. The study's findings, which estimate approximately 44,000 preventable deaths annually across 15 African countries, show that FGMC accounts for more deaths than several other well-known health threats, including HIV, AIDS, measles, and tuberculosis. The scale of the crisis. Female genital mutilation cutting is a deeply rooted tradition practiced in at least 25 African countries, as well as parts of the Middle East, Asia, and among immigrant populations globally. The procedure involves the removal or damage of female genital tissue, typically carried out in non-medical settings without anesthesia or proper medical supervision. Despite efforts to eradicate this practice, FGMC continues to affect around 200 million women and girls worldwide. The new research indicates that FGMC is not only a source of physical pain and psychological trauma, but is also a major public health issue. In countries where the practice is prevalent, FGMC leads to severe bleeding, infections, shock, and obstructed labor, all of which contribute to the high mortality rate associated with it. This grim reality underscores that FGMC is a serious threat to public health, with consequences that extend far beyond the immediate harm caused to individuals. A comparative analysis of Africa. The prevalence of FGMC varies significantly across the African continent, with some countries showing exceptionally high rates. Guinea, for instance, has one of the highest rates of FGMC, with 97% of women and girls affected, followed by Mali at 83% and Sierra Leone at 90%. This compares to Egypt, where 87% of women and girls are subjected to FGMC, illustrating that the practice is not confined to sub-Saharan Africa, but also affects parts of North Africa. Such high rates are not just statistics, they represent the lived realities of millions of women and girls who endure the painful consequences of this practice. One of the key findings of the study is the scale of excess mortality caused by FGMC. The research estimates that FGMC is responsible for approximately 44,000 deaths each year across 15 African countries. This statistic is sobering when compared to armed conflicts, which are responsible for about 48,000 deaths annually on the continent. Thus, FGMC emerges as a significant public health threat, outpacing other causes of death such as HIV, AIDS, and respiratory infections. While these figures are alarming, tracking deaths directly linked to FGMC has historically been challenging. The clandestine nature of the procedure, often conducted in rural areas with limited medical supervision, makes it difficult to quantify the full extent of the practice's mortality impact. Furthermore, the stigma surrounding FGMC often leads to underreporting, hindering accurate assessments. The long-term consequences. The immediate physical consequences of FGMC include severe bleeding, infections, and shock, but the long-term effects are even more troubling. Survivors of FGMC often face complications during childbirth, including obstructed labor, which increases the risk of maternal and neonatal mortality. Additionally, FGMC has been linked to a range of psychological issues, including post-traumatic stress disorder, PTSD, depression, and anxiety, often resulting in a lifetime of emotional scars. The practice also has social consequences, particularly in communities where FGMC is seen as a prerequisite for marriageability. In many places, girls who have not undergone FGMC are viewed as unmarriageable or unclean, perpetuating a cycle of gender-based violence and discrimination. The societal pressure to conform to these traditions leaves many families with little choice but to subject their daughters to the practice. Addressing the public health crisis. The findings of this study point to the urgent need for comprehensive and integrated approaches to combat FGMC. Legal reforms are essential, as FGMC remains legal in 5 of the 28 countries where it is most practiced. However, laws alone will not be sufficient to eradicate this practice. There must be a concerted effort to engage communities, educate the public, and provide support for grassroots organizations that are working to challenge cultural beliefs and practices that perpetuate FGMC. One promising development has been the use of education and media campaigns to raise awareness about the dangers of FGMC. For example, in Egypt, increased social media reach and the use of educational films have been shown to reduce FGMC rates in some areas. These campaigns often present alternative perspectives on the practice, challenging the cultural norms that sustain it. Community-led initiatives have also proven effective in changing attitudes toward FGMC. In many African communities, local leaders, including religious and cultural figures, have become powerful allies in the fight against FGMC. Their involvement can help shift cultural perceptions and foster a new understanding of women's rights and gender equality. Furthermore, international cooperation and funding are critical to supporting these initiatives and scaling them up. The COVID-19 pandemic has had a detrimental effect on efforts to combat FGMC, potentially leading to an increase in the number of girls subjected to the practice. The UN estimates that the pandemic may have resulted in 2 million additional cases of FGMC, translating to 4,000 additional deaths in the countries studied. The road ahead, ending FGMC. Ending FGMC requires a multifaceted approach that goes beyond legal reforms to include education, community engagement, and increased investment in public health. Efforts must be scaled up to reach more communities, and there needs to be a focus on building a network of support for women and girls who are at risk of FGMC. The study's authors argue that FGMC should be prioritized as a major public health challenge, alongside other infectious diseases such as malaria and tuberculosis. The long-term benefits of ending FGMC are immeasurable, not just for the health of women and girls, but for the broader development of African societies. Ultimately, the challenge of eradicating FGMC is a race against time. Every year that passes without decisive action results in thousands of preventable deaths, many of which could be avoided with improved health care, education, and community engagement. It is incumbent upon governments, international organizations, and local communities to work together to bring an end to this harmful practice and ensure a healthier, safer future for girls and young women across Africa. The global context. The fight against FGMC is not isolated to Africa alone. It is part of a broader global movement to end gender-based violence and promote women's rights. The international community has a critical role to play in supporting African countries in their efforts to eradicate FGMC. With ongoing research, advocacy, and collaboration, it is possible to envision a future where FGMC is consigned to history and the lives of millions of girls and women are spared from its devastating effects. The new study on FGMC brings into sharp focus the scale of the crisis. Yet, it also highlights the potential for change. As Africa grapples with a range of socio-economic challenges, the end of FGMC must be seen as a key pillar of the region's public health and human rights agenda. The journey toward the abolition of FGMC will be long and fraught with challenges, but the stakes are too high to ignore. The lives of millions of girls and young women depend on it. Cultural and societal dynamics of FGMC. While the physical and psychological toll of FGMC is devastating, the practice is also intricately tied to social and cultural expectations. For many communities, it is not just a physical procedure, but a rite of passage that marks a girl's transition into womanhood. The belief that FGMC is necessary for marriage and social acceptance reinforces the deeply ingrained gender inequalities present in these societies. In some regions, girls who are not subjected to FGMC face rejection, ridicule, or even ostracism, making it incredibly difficult for families to resist the pressure to conform. Furthermore, FGMC is often tied to broader issues of power and control. In patriarchal societies, the practice is justified as a means of controlling female sexuality, ensuring purity, and safeguarding family honor. These deeply held beliefs, though harmful, are seen to maintain social order and uphold traditional values. For this reason, efforts to combat FGMC face significant cultural resistance, as challenging the practice is seen by some as an attack on their cultural identity and heritage. Changing these cultural perceptions requires more than just legal prohibitions. It involves engaging with communities to foster a deeper understanding of the harm caused by FGMC and offering alternative rites of passage that retain cultural significance without subjecting girls to harm. Education, awareness, and sensitization programs must be tailored to the local context, addressing the cultural beliefs that sustain FGMC while promoting healthier, safer alternatives. The role of education in ending FGMC. Education is one of the most powerful tools in the fight against FGMC. Studies have shown that when communities are educated about the risks associated with FGMC, the practice tends to decline. One of the most effective approaches is to involve young people in conversations about gender equality, sexual and reproductive health, and human rights. By empowering both girls and boys to challenge harmful gender norms, education can help break the cycle of FGMC. In many African countries, girls who undergo FGMC are at a heightened risk of dropping out of school. The physical consequences of the procedure, such as chronic pain and infections, can interfere with their ability to attend school and focus on their studies. Moreover, the psychological trauma caused by FGMC can leave lasting emotional scars that affect a girl's overall well-being and sense of self-worth. By educating girls and their families about the risks and consequences of FGMC, it is possible to protect their health, well-being, and prospects. International organizations and governments should prioritize integrating FGMC awareness and gender-based violence education into national school curricula. This will ensure that young people, particularly those in high-risk communities, are equipped with the knowledge and tools they need to resist harmful practices like FGMC. The goal is to create a generation of young people who reject FGMC as a norm and embrace healthier, more empowering traditions. International support and accountability. While local efforts are critical in the fight against FGMC, international support is equally essential. Organizations such as the United Nations, the World Health Organization, WHO, and various NGOs have been at the forefront of the global campaign to end FGMC. These organizations provide technical assistance, financial support, and advocacy to help African countries combat the practice. The United Nations has set ambitious goals as part of its 2030 Agenda for Sustainable Development, which includes the elimination of harmful practices such as FGMC. However, these goals can only be achieved through sustained political will, comprehensive national policies, and regional cooperation. International pressure and support are key to holding governments accountable for implementing effective laws and policies to combat FGMC. Moreover, the international community must recognize the need for more resources to support grassroots organizations working directly with communities. These local organizations are often best positioned to create lasting changes by building trust, understanding cultural nuances, and facilitating dialogue about the dangers of FGMC. The role of technology and social media. In recent years, technology and social media have played an increasingly significant role in raising awareness and mobilizing action against FGMC. Social media platforms provide a powerful tool for advocacy, enabling activists to reach a global audience and engage with communities that may not otherwise have access to information. By using social media campaigns, storytelling, and educational videos, organizations have been able to spark conversations and challenge the cultural norms that sustain FGMC. For example, the Dr. End FGM campaign has gained widespread attention using platforms like Twitter, Facebook, and Instagram to amplify voices from survivors, activists, and organizations working to end the practice. These campaigns provide a platform for victims to share their stories, raise awareness about the consequences of FGMC, and mobilize support for legal and cultural reforms. In addition to social media, the use of mobile technology in Africa has proven effective in disseminating information about FGMC. Mobile health initiatives, which provide information about sexual and reproductive health, have been shown to reduce the incidence of FGMC in some regions. By leveraging the power of mobile phones and other digital technologies, it is possible to reach remote communities with information that can save lives and change attitudes. Addressing the impact of COVID-19 on FGMC. The COVID-19 pandemic has had a profound impact on efforts to combat FGMC. The disruptions caused by lockdowns, the closure of schools, and the reduction in health services have created new challenges for communities already at risk of FGMC. The United Nations estimates that the pandemic has led to an additional 2 million cases of FGMC, which could result in thousands of preventable deaths. The economic and social consequences of the pandemic have also made it more difficult for families to resist the pressure to subject their daughters to FGMC. In times of crisis, families may feel compelled to adhere to traditional practices as a way of ensuring their daughters' future social and economic security. This highlights the need for comprehensive, long-term strategies to address the root causes of FGMC, including poverty, lack of education, and gender inequality. To mitigate the impact of COVID-19 on efforts to end FGMC, governments and international organizations must strengthen their commitment to the issue and adapt their strategies to the current context. This includes expanding the reach of virtual education campaigns, providing financial and logistical support to local organizations, and ensuring that health services are accessible to those who need them most. The need for a global movement FGMC is not just an African issue, it is a global human rights issue. The practice affects millions of women and girls around the world, and its eradication requires a global movement that brings together governments, international organizations, civil society, and communities. By working together, we can create a world where every girl is free from the threat of FGMC and can grow up healthy, safe, and empowered. Ending FGMC is not just a matter of preventing death or physical harm. It is about ensuring that women and girls have the agency to control their own bodies, make choices about their lives, and live free from violence and discrimination. As long as FGMC continues to affect millions of girls and women, the fight for gender equality remains incomplete. It is a fight that requires the unwavering commitment of all stakeholders, and the time to act is now. The path to ending FGMC, collaborative approaches. Achieving the end of female genital mutilation, cutting, FGMC, is a multi-layered challenge that requires collaboration at all levels of society. Governments, international organizations, civil society groups, and local communities must work together to create sustainable change. This partnership approach ensures that all aspects of the issue, from legal reform to cultural attitudes, are addressed. At the governmental level, strong political will is essential. Many African governments have passed laws banning FGMC, yet enforcement remains a major hurdle. In some countries, legal frameworks are either weak or poorly implemented, with local authorities unable or unwilling to enforce laws against the practice. Strengthening the capacity of law enforcement to act against FGMC, particularly in rural areas, is a critical part of the solution. Moreover, governments need to allocate more resources to the fight against FGMC, ensuring that anti-FGMC programs are well-funded and equipped to succeed. International organizations play a crucial role in providing both technical and financial support. The World Health Organization, WHO, and UNICEF have been instrumental in providing data, resources, and advocacy to raise awareness about the dangers of FGMC. These organizations also support governments in designing and implementing policies aimed at ending the practice. However, the international community must continue to increase pressure on countries that have not yet implemented or fully enforced anti-FGMC laws. Empowering women and girls, grassroots and local initiatives. The involvement of grassroots organizations is central to the fight against FGMC. These organizations are often the first to understand the cultural dynamics and deeply held beliefs within local communities. They can leverage this knowledge to create interventions that are both culturally sensitive and effective in changing behavior. For example, local leaders, such as religious and traditional figures, can be powerful allies in promoting change. When these figures speak out against FGMC, they can help shift community attitudes and create an environment where the practice is no longer seen as acceptable. Empowering women and girls is also crucial in the fight against FGMC. Programs that focus on educating girls about their rights, health, and well-being are vital in preventing the practice from being perpetuated. These programs often focus on building self-esteem, providing support networks, and raising awareness about the dangers of FGMC. By equipping young women with the tools they need to advocate for themselves, these initiatives help foster a generation that is more likely to resist harmful practices. Furthermore, economic empowerment plays a significant role in eradicating FGMC. Many families subject their daughters to FGMC to ensure that they will be considered marriageable. Providing economic opportunities for women and girls can break this cycle, as families may no longer feel the need to follow tradition to secure their daughters' futures. Vocational training, access to microfinance, and job opportunities can empower women and help reduce the financial pressures that contribute to the continuation of FGMC. The role of technology in eradicating FGMC. Technology has the potential to play a transformative role in the global fight against FGMC. With the increasing availability of mobile phones and internet access in many African countries, digital platforms offer a unique opportunity to spread awareness, provide education, and mobilize communities to act. Social media has proven to be a powerful tool for advocacy and raising awareness about FGMC. Platforms like Facebook, Twitter, and Instagram allow activists to share stories, organize campaigns, and engage with a global audience. These platforms provide a space for survivors to share their experiences, which can be both cathartic and inspiring for others who may be experiencing similar challenges. By using hashtags like #DasEndFGM and StopFGM, activists have been able to spark conversations and build international solidarity in the fight against this harmful practice. Mobile phones have also facilitated access to health information. In many rural areas, mobile health initiatives have provided crucial information about sexual and reproductive health, as well as the risks associated with FGMC. These initiatives can be particularly effective in areas where traditional education systems may be lacking or where illiteracy rates are high. Additionally, mobile platforms can serve as a means of reporting incidents of FGMC, providing a confidential way for individuals to seek help and report abuses without fear of retribution. One example of the use of technology in this regard is the development of mobile apps that educate young people about FGMC, provide support networks, and connect users with services and resources. Such technology has the potential to complement traditional methods of advocacy and create a more effective, wide-reaching movement to end FGMC. Evaluating the effectiveness of current efforts. While progress has been made in certain regions, the fight to end FGMC is far from over. In some countries, there has been a significant reduction in the prevalence of FGMC thanks to legislative changes, community-based interventions, and education campaigns. However, the rate of decline has been uneven, and in certain regions, the practice remains widespread. One of the main challenges is ensuring that communities where FGMC is still practiced have access to accurate information and support. Many women and girls remain unaware of the long-term consequences of FGMC, and some are still convinced that the practice is a necessary part of their culture or religion. Additionally, economic pressures, such as poverty and lack of education, continue to drive families to uphold this harmful tradition. As efforts to combat FGMC progress, it is essential to assess and evaluate the impact of ongoing initiatives. What works in one community or region may not necessarily be effective in another, and solutions must be tailored to the specific context in which they are implemented. Continuous monitoring, research, and feedback are essential for adapting strategies and ensuring that interventions are achieving their desired outcomes. Collaboration with traditional and religious leaders. A key to successful FGMC eradication efforts lies in engaging with traditional and religious leaders. In many African communities, these leaders are highly influential and often hold significant sway over social practices. When they speak out against FGMC, their voices can have a profound impact on the community's perceptions and behavior. Religious leaders, particularly from Islam and Christianity, have begun to play an increasingly important role in promoting anti-FGM messages. In some instances, local imams and priests have publicly declared that FGMC has no religious basis, which has been a critical step in reducing its prevalence in certain regions. Similarly, traditional healers who once performed FGMC are being trained to offer alternative, non-harmful rituals as part of cultural preservation efforts. Furthermore, the support of community leaders helps ensure that anti-FGMC campaigns are locally relevant and culturally sensitive. Community-driven solutions that respect local traditions while addressing the harm of FGMC are more likely to be embraced by the people they seek to protect. The road to global solidarity. FGMC is not a problem confined to any one country or region. It is a global issue that requires global action. Governments, international organizations, civil society, and grassroots communities must unite to create a world where every girl is free from the threat of FGMC. While the road ahead is challenging, the collective will to end this practice is growing stronger, and there is hope for a future where FGMC no longer claims the lives and health of girls and women. As the fight continues, it is critical that we keep the momentum going. Public awareness campaigns, increased funding for anti-FGMC programs, and sustained international pressure will all be necessary to ensure that FGMC becomes a practice of the past. The efforts of governments, international bodies, and grassroots organizations must be seen as part of a broader human rights agenda to protect the health and dignity of women and girls worldwide. Looking forward, a call to action. The study showing the devastating mortality rates linked to FGMC underscores the urgency of the matter. It serves as a clarion call to every corner of the globe, urging leaders, activists, and citizens to act with greater commitment and urgency. FGMC is not just a health issue, it is a human rights violation that affects the very core of a society's values regarding gender equality and the treatment of women and girls. By continuing to build on the momentum already achieved, and by scaling up efforts across the continent and beyond, we can eradicate FGMC. The time to act is now, and the world must unite in solidarity to protect the rights, health, and dignity of millions of girls and women who deserve to live free from the threat of this harmful practice. The importance of data collection and research in combating FGMC. One of the key challenges in eradicating female genital mutilation, cutting, FGMC, is the lack of accurate data, which hinders the development of targeted interventions. While the recent study has provided important insights into the scale of the problem, consistent and reliable data is essential to understanding the full extent of FGMC and informing effective policies. Data collection on FGMC must be comprehensive, covering not only the incidence of the practice, but also its long-term effects on health and well-being. Investing in robust research that tracks the prevalence of FGMC over time is vital. This includes collecting data on the age at which girls are subjected to the procedure, the geographical regions most affected, and the socioeconomic factors that drive families to continue the practice. Research should also explore the effectiveness of different anti-FGMC interventions, such as education campaigns, legislative changes, and community-led initiatives. This would allow for a better understanding of what works and where additional efforts are needed. Additionally, it is important that research on FGMC is inclusive of the voices of survivors. Survivors' stories can provide valuable insights into the emotional and psychological impact of the practice, as well as the long-term consequences on physical health, relationships, and social status. By amplifying the voices of those who have lived through FGMC, the global community can build a more comprehensive understanding of the issue and ensure that interventions are designed with survivors' needs in mind. Furthermore, data on FGMC should be integrated into national health and education systems, ensuring that it is used to inform policy decisions and the allocation of resources. For instance, data on the health consequences of FGMC can be used to justify increased investment in maternal and child health services, while data on the socioeconomic factors that drive the practice can inform education programs targeting at-risk communities, legal frameworks, and enforcement, strengthening the fight against FGMC. While many African countries have passed laws banning female genital mutilation, cutting, FGMC, legal frameworks alone are not enough to end the practice. Effective enforcement of these laws is crucial for ensuring that those who carry out FGMC are held accountable. However, law enforcement often faces significant challenges, particularly in rural areas where the practice is most prevalent. In some regions, local authorities may be unwilling to enforce anti-FGMC laws due to cultural or political factors, or because they lack the resources and training to do so effectively. For instance, traditional leaders and local practitioners may continue to carry out the procedure in secret, making it difficult for authorities to detect and prevent FGMC. Therefore, it is essential to strengthen the capacity of law enforcement agencies at all levels, ensuring that they have the knowledge and resources needed to investigate and prosecute cases of FGMC. Moreover, the legal framework must be complemented by broader measures that address the underlying causes of FGMC, such as poverty, lack of education, and entrenched gender inequalities. In many communities, FGMC is seen as a necessary practice for ensuring a girl's future marriage prospects and social acceptance. Legal reforms must therefore be part of a broader societal transformation that challenges harmful gender norms and empowers women and girls to make decisions about their own bodies. Importantly, the legal response to FGMC must also protect those who are at risk of the practice. This includes offering safe spaces for girls and women who wish to escape the threat of FGMC, providing legal recourse for survivors, and ensuring that communities have access to the resources and support they need to resist the pressure to continue the practice. The role of men and boys in ending FGMC. While the fight to end female genital mutilation, cutting, FGMC, has primarily focused on women and girls, it is important to recognize the role that men and boys can play in driving change. In many communities, FGMC is perpetuated by deeply rooted patriarchal beliefs that view women and girls as subordinate to men. These beliefs are often linked to ideas of female purity, marriageability, and family honor. To create lasting change, it is essential to involve men and boys in the fight against FGMC. By challenging traditional gender roles and promoting gender equality, men and boys can help shift the cultural norms that perpetuate the practice. For example, male community leaders, fathers, and husbands can be powerful advocates for abandoning FGMC, especially if they are educated about the harmful consequences of the practice. Education programs that engage men and boys can be particularly effective in challenging the cultural attitudes that sustain FGMC. These programs should focus on promoting healthy masculinity, respecting women's rights, and understanding the physical and emotional harm caused by FGMC. When men and boys become active allies in the fight against FGMC, they can help create a supportive environment for women and girls, encouraging them to resist the pressure to undergo the procedure. Furthermore, engaging men and boys in this movement can help address the root causes of FGMC, such as the belief that women must be controlled for their sexuality to be deemed acceptable. By shifting these societal views, men and boys can play a crucial role in dismantling the cultural and social structures that enable FGMC to persist. Collaboration with international organizations. The global community has a critical role to play in the fight to end female genital mutilation cutting, FGMC. International organizations such as the United Nations, WHO, UNICEF, and the World Bank have been instrumental in raising awareness, providing technical support, and advocating for legislative change. However, more action is needed to ensure that FGMC eradication efforts are prioritized and adequately funded. One of the most effective ways international organizations can support local efforts is by providing financial assistance to grassroots organizations that are working directly with communities to end FGMC. These organizations have a deep understanding of the cultural dynamics at play and are often the most effective in delivering targeted interventions. By supporting these local organizations, international bodies can ensure that resources are directed toward the communities where they are needed most. In addition to providing financial support, international organizations can also assist with research and data collection, helping countries track progress in eliminating FGMC and assess the effectiveness of various interventions. They can also facilitate knowledge sharing and the exchange of best practices between countries, enabling communities to learn from one another and adopt successful strategies for eradicating FGMC. Finally, international organizations must continue to advocate for stronger legal frameworks and hold governments accountable for their commitments to ending FGMC. By applying pressure on governments and urging them to take decisive action, these organizations can help ensure that anti-FGMC laws are not only passed, but also enforced. A global movement for change, female genital mutilation, cutting, FGMC, is a harmful practice that affects millions of women and girls across Africa and beyond. It causes immeasurable physical, psychological, and social harm, and it is a violation of the fundamental human rights of girls and women. The recent research highlighting the devastating mortality rates associated with FGMC underscores the urgency of ending the practice once and for all. While progress has been made in some regions, much work remains to be done. The fight against FGMC requires a comprehensive, multifaceted approach that includes legal reforms, community engagement, education, and international support. It is essential that all stakeholders, governments, international organizations, civil society, and communities work together to ensure that every girl is free from the threat of FGMC and able to live a healthy, safe, and empowered life. By continuing to raise awareness, strengthen legal frameworks, engage communities, and provide support for grassroots efforts, we can create a world where FGMC is no longer a threat. The time to act is now, and the world must come together to end this practice once and for all, addressing the economic costs of FGMC. The economic consequences of female genital mutilation, cutting, FGMC, are often overlooked, but are deeply significant for both individuals and society. The practice places a heavy burden on national healthcare systems, costing governments millions of dollars each year. This includes the direct costs associated with treating the immediate complications of FGMC, such as infections, excessive bleeding, and trauma, as well as the long-term healthcare costs related to childbirth complications, infertility, and other chronic conditions resulting from the practice. The World Health Organization, WHO, estimates that the cost of medical care for FGMC survivors is substantial, often requiring long-term treatment for complications that can last a lifetime. These costs divert resources away from other critical health issues, further straining healthcare systems that are already under-resourced. In countries where FGMC is prevalent, health systems are burdened by the need for specialized care for women who experience obstructed labor, complications during childbirth, and other health issues linked to FGMC. From an economic standpoint, the financial strain of FGMC on healthcare systems could be alleviated by eradicating the practice. By eliminating FGMC, resources that are currently dedicated to treating its consequences could be reallocated to other areas of public health, such as maternal care, child nutrition, and prevention of infectious diseases. This would not only improve the health outcomes of women and girls, but also allow governments to use their limited resources more efficiently. Moreover, FGMC has an indirect economic impact on the broader economy. Women who have undergone FGMC are more likely to experience reproductive health issues, which can reduce their productivity and limit their ability to contribute to the workforce. The practice can also negatively affect educational attainment, as girls who experience FGMC may be more likely to drop out of school due to health complications or social stigma. This, in turn, affects national development and the overall economic growth of a country. Investing in the eradication of FGMC should be seen not just as a human rights issue, but also as an economic imperative. The long-term economic benefits of eliminating FGMC far outweigh the short-term costs of implementing comprehensive anti-FGMC policies and programs. Reducing the prevalence of FGMC can contribute to healthier, more productive societies, with women and girls better able to contribute to the economic development of their countries. Strengthening regional and international collaboration. The fight against FGMC cannot be won in isolation. It requires strong collaboration between governments, regional organizations, and international actors. While many African countries have enacted laws against FGMC, there is still a need for better coordination across borders, especially in regions where FGMC is widespread and transnational movements of people and practices occur. Regional cooperation can play a significant role in ending FGMC, particularly in areas where the practice transcends national borders. For example, countries within the East African Community, EAC, West African Economic and Monetary Union, WAEMU, and the Economic Community of West African States, ECO-WAS, can collaborate on developing and implementing regional strategies to combat FGMC. Such collaborations can include sharing best practices, providing cross-border legal support, and working together to create awareness campaigns that target entire regions. The African Union, AU, has already made strides in addressing FGMC as part of its broader commitment to women's rights and gender equality. Through the Maputo Protocol, which calls for the protection of women's health and rights, the African Union has placed pressure on governments to outlaw harmful practices like FGMC. However, more needs to be done to ensure that countries are held accountable for implementing these policies and that regional initiatives are better coordinated. International collaboration is also crucial in providing the resources, expertise, and technical support needed to combat FGMC effectively. Partnerships with global organizations such as the United Nations Population Fund, UNFPA, UNICEF, and WHO have proven instrumental in supporting national and regional efforts. These organizations have not only helped raise awareness, but have also provided financial support and technical expertise to governments and local organizations working to eliminate FGMC. A key example of international collaboration is the joint UNFPA-UNICEF initiative to accelerate the abandonment of FGMC by 2030, which has helped align efforts across countries, regions, and sectors. The initiative has led to an increase in the number of countries that are actively working to end the practice. However, international organizations must continue to increase their investment and support for grassroots and community-led initiatives, which are critical to sustainable change. The power of survivor-led movements. One of the most powerful forces in the fight to end FGMC is the voices of survivors. Women and girls who have experienced FGMC firsthand possess invaluable insights into the practice, its effects, and the societal pressures that perpetuate it. Survivor-led movements are increasingly central to advocacy efforts as they provide a platform for those who have lived through FGMC to share their stories and drive the movement forward. Survivors often take on leadership roles within their communities, challenging the norms that allow FGMC to persist. Their testimony can be a potent tool in educating others about the dangers of the practice, breaking down the stigma that surrounds it, and encouraging families and communities to abandon it. By putting survivors at the forefront of anti-FGMC campaigns, organizations can create more authentic and powerful calls for change. In many cases, survivor-led initiatives are more successful because they are based on the lived experiences of those directly affected. These initiatives can include support networks for survivors, counseling services, and safe spaces where women and girls can find solidarity and healing. Survivors often work in collaboration with traditional leaders, health professionals, and legal experts to create locally tailored interventions that challenge the cultural justifications for FGMC and provide alternative solutions. Through survivor-led activism, communities can begin to see that FGMC is not an inevitable or necessary part of their culture, but rather a harmful practice that can be abandoned without losing cultural identity. When survivors speak out, they break the silence surrounding FGMC and create a ripple effect that inspires others to join the movement. The role of media and advocacy campaigns. Media plays a vital role in shaping public perceptions and advancing social change. The power of television, radio, social media, and print media in raising awareness about FGMC cannot be overstated. Advocacy campaigns that use media to reach large audiences can educate the public, challenge traditional beliefs, and mobilize individuals to act. In recent years, social media has emerged as a particularly effective tool in raising awareness about FGMC. Hashtags like #EndFGM and #StopFGM have gained significant traction globally, helping to create an online community of activists, survivors, and supporters. These campaigns leverage the viral nature of social media to spread messages about the dangers of FGMC and rally support for its eradication. Documentaries, television shows, and radio programs have also been effective in raising awareness about FGMC. These media platforms provide an opportunity to tell the stories of survivors, showcase the harmful effects of FGMC, and present alternative cultural practices. In some cases, local radio stations and community television channels have been instrumental in spreading messages of hope and change to rural areas, where FGMC is most prevalent. Moreover, celebrities and public figures can use their platforms to highlight the issue and bring global attention to the fight against FGMC. By aligning with anti-FGMC campaigns, they can help amplify the message and reach a broader audience, especially younger generations who may not otherwise be exposed to this issue. A unified global effort. The effort to end female genital mutilation cutting, FGMC, is an ongoing struggle that requires a unified, global approach. The practice continues to devastate the lives of millions of women and girls across Africa and beyond, but there is hope. Through sustained efforts at the local, national, and international levels, it is possible to eradicate this harmful tradition and ensure that every girl is free from the threat of FGMC. The road to ending FGMC will not be easy, but with increased awareness, stronger legal frameworks, and collaboration between governments, international organizations, communities, and survivors, progress can be made. By prioritizing the health, safety, and dignity of women and girls, and by challenging harmful cultural norms, we can build a future where FGMC is no longer a threat to the lives and well-being of millions. The role of local communities in shaping change. A critical factor in the success of efforts to end female genital mutilation, cutting, FGMC, is the active involvement of local communities. While laws and international pressure are important, sustainable change occurs when local communities are empowered to take action. In many regions, FGMC is deeply entrenched within the culture and social fabric, and change cannot happen unless those who practice FGMC are engaged in meaningful dialogue about the harmful effects of the practice. Community leaders, including religious figures, elders, and traditional healers, play an essential role in influencing public opinion. These individuals hold significant authority in their communities, and their endorsement can lead to powerful shifts in attitudes toward FGMC. By involving these leaders in advocacy campaigns, it becomes easier to challenge the cultural justification for FGMC and open the door to alternatives that retain cultural significance without inflicting harm. Local communities must also be supported in identifying their own solutions to the problem. Anti-FGMC initiatives that are driven by local ideas and leadership are more likely to succeed because they are seen as legitimate and rooted in local knowledge. Community members are more willing to abandon harmful practices when they are part of the solution, rather than feeling as though the change is being imposed on them from the outside. As such, it is essential to empower communities by providing the tools, resources, and education they need to break the cycle of FGMC. The importance of mental health support for survivors. The impact of female genital mutilation, cutting, FGMC, extends far beyond the immediate physical harm. It also causes long-lasting psychological trauma. For many survivors, the trauma is not just related to the pain and complications of the procedure, but also the psychological toll of living in a society that sees them as unclean or imperfect. Mental health support for survivors of FGMC is a critical component of the broader strategy to address the practice. Many survivors of FGMC suffer from post-traumatic stress disorder, PTSD, depression, anxiety, and other mental health issues as a result of their experiences. The trauma can also affect their relationships and social interactions, particularly if they live in communities where FGMC is still viewed as necessary. For survivors to heal, they need access to mental health services that are tailored to their unique experiences and cultural context. Support groups and counseling services for survivors can help them process their trauma and rebuild their sense of self-worth. It is also important that healthcare providers are trained to recognize the psychological impact of FGMC and to offer appropriate support. This approach goes beyond simply treating the physical complications of FGMC. It also addresses the emotional and psychological wounds that many survivors carry for a lifetime. The mental health needs of survivors must be a priority in anti-FGMC programs. By ensuring that survivors have access to counseling, therapy, and support networks, we can help them heal and empower them to become advocates for change within their communities. Survivor-led initiatives that offer support and healing opportunities also serve as a source of inspiration and hope for others who may be suffering in silence. International laws and conventions, strengthening legal instruments. At the global level, laws and conventions play a crucial role in the fight against female genital mutilation, cutting, FGMC. Several international human rights conventions explicitly prohibit FGMC, recognizing it as a violation of the rights of women and girls. These legal instruments provide a foundation for countries to develop their own laws and frameworks to protect individuals from this harmful practice. One of the key international instruments is the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW, which calls for the elimination of all practices that harm women and girls. CEDAW has been adopted by most countries, making it a critical tool in the fight against FGMC. Additionally, the African Union's Maputo Protocol, 2003, specifically addresses harmful practices such as FGMC and calls for the eradication of such practices across the continent. These legal frameworks set clear standards for the protection of women and girls, but their enforcement remains a challenge in many countries. International conventions alone are not enough to end FGMC. Governments must take proactive steps to ratify and implement these conventions into national law. Moreover, the international community must hold governments accountable for enforcing anti-FGMC laws and ensuring that perpetrators of the practice are prosecuted. Increased international pressure, combined with the efforts of local and regional organizations, is necessary to compel governments to take stronger action against FGMC. The role of education in preventing FGMC education remains one of the most effective tools in preventing female genital mutilation, cutting, FGMC. When communities are educated about the health risks and human rights violations associated with FGMC, the practice tends to decline. Education programs that target both young people and adults can change attitudes, debunk myths, and raise awareness about the consequences of FGMC. Educational programs should start early, integrating lessons about gender equality, human rights, and sexual and reproductive health into school curricula. This early education can prevent the next generation from perpetuating harmful cultural practices and create a foundation for long-term change. When children are taught about their rights, they are better equipped to resist societal pressures and advocate for themselves and others. For adults, education campaigns should focus on dispelling the myths that perpetuate FGMC, particularly the belief that it is necessary for marriageability or social acceptance. These campaigns can use a variety of mediums, including radio programs, community workshops, and social media, to reach a wide audience. One of the key challenges is to ensure that these educational efforts are culturally sensitive and tailored to the specific beliefs and practices of the communities they are targeting. In many regions, there is a need for programs that specifically target parents and families, explaining how FGMC negatively impacts the health and future well-being of their daughters. By emphasizing the health risks, such as complications during childbirth and the potential for lifelong physical and psychological harm, education campaigns can encourage families to abandon the practice in favor of healthier alternatives. Rebuilding cultural identity. Without FGMC. One of the most significant barriers to ending female genital mutilation, cutting, FGMC, is the belief that the practice is central to cultural identity and traditions. For many communities, FGMC is seen as an essential rite of passage that marks a girl's transition to womanhood. To end FGMC, it is crucial to find ways to preserve cultural identity without resorting to harmful practices. Community leaders and cultural advocates can play a pivotal role in finding alternative rituals and ceremonies that celebrate the transition to womanhood without causing harm. These alternative rites of passage can be developed in collaboration with local communities and designed to retain cultural significance while protecting the health and well-being of girls. For example, in some communities, alternatives to FGMC have been created that involve symbolic acts of empowerment, such as coming-of-age ceremonies that focus on education, leadership, and community service. In addition, it is important to engage traditional healers and practitioners in conversation. Many traditional healers who once performed FGMC can be trained to offer safe, non-harmful alternatives that align with cultural beliefs. Their involvement in the movement can help to shift the perception that FGMC is a necessary part of tradition and promote practices that do not cause harm. By finding ways to celebrate cultural identity without the need for FGMC, communities can help girls grow up in a healthier, safer environment while maintaining their cultural heritage. The challenge is to find alternatives that resonate with the community while ensuring that girls are protected from harm. Building stronger healthcare systems to address FGMC. A robust healthcare system is essential for addressing the consequences of female genital mutilation, cutting, FGMC, and supporting survivors. In many countries where FGMC is prevalent, healthcare systems are ill-equipped to provide the specialized care needed for FGMC survivors, particularly in rural and underserved areas. Strengthening healthcare systems to address the physical and psychological aftermath of FGMC is a critical part of the global effort to eliminate the practice. Healthcare providers must be trained to recognize the complications associated with FGMC and provide appropriate care. This includes treatment for immediate complications, such as infections and bleeding, as well as long-term care for issues like obstructed labor, infertility, and sexual dysfunction. Specialized training should also include how to handle the psychological trauma experienced by many survivors, ensuring that medical staff are equipped to provide holistic care that addresses both the physical and emotional needs of patients. In addition to strengthening healthcare systems to address the needs of survivors, efforts should be made to provide preventative care and education in communities where FGMC is practiced. Healthcare providers can play a key role in raising awareness about the dangers of FGMC, providing information to families, and supporting efforts to abandon the practice. By integrating anti-FGMC education into primary healthcare services, communities can be empowered to make informed decisions about their health and well-being. Furthermore, healthcare systems in countries where FGMC is widespread must work to create safe spaces where women and girls can seek help without fear of judgment or retaliation. This includes providing confidential counseling, offering safe delivery options for women who have undergone FGMC, and ensuring that there are legal protections in place for those who wish to report FGMC-related incidents. As healthcare systems evolve, it is also critical to ensure that the health needs of women and girls are prioritized in national and international health agendas. This includes increasing funding for maternal and reproductive health services that specifically address the needs of survivors of FGMC, and advocating for the inclusion of FGMC-related health issues in global health frameworks. Mobilizing religious and cultural leaders. Religious and cultural leaders hold significant influence in many communities where female genital mutilation, cutting, FGMC, is practiced. Their role in shaping public opinion and social norms cannot be overstated. Engaging religious and cultural leaders in the fight against FGMC is essential for creating widespread change and shifting entrenched cultural practices. In many African communities, FGMC is justified on religious or cultural grounds, with some believing that the practice is a sacred tradition or a religious obligation. However, many religious leaders, after being educated about the health risks and human rights violations associated with FGMC, have begun to speak out against it. For example, some imams in Muslim communities and priests in Christian communities have publicly declared that FGMC is not supported by religion and should not be practiced. Religious leaders who are respected by their communities can help to counter the narratives that justify FGMC, using their platforms to advocate for the protection of girls and women. These leaders can also play a role in redefining traditional ceremonies, creating alternative rites of passage that celebrate girls coming of age without causing harm. Through their influence, religious and cultural leaders can reshape the narrative around FGMC, encouraging communities to abandon the practice while preserving their cultural identities. Furthermore, interfaith dialogues and partnerships can be powerful tools in addressing FGMC. Bringing together religious leaders from different faiths to discuss the issue and collaborate on anti-FGMC initiatives can help to create a united front against the practice, one that transcends individual religious boundaries and focuses on the shared goal of protecting the rights and health of women and girls. Using the media as a tool for cultural change, media plays an increasingly important role in shaping cultural attitudes and norms. In the fight against FGMC, the media can be an invaluable tool for raising awareness, educating the public, and promoting alternative cultural practices that do not involve harm. Television, radio, newspapers, and digital platforms can all be used to disseminate information, challenge myths, and amplify the voices of survivors. In many African countries, the media is the most effective way to reach large and diverse audiences. Community radio stations and local TV networks have proven effective in engaging rural populations and remote communities, where FGMC is most prevalent. Media campaigns that focus on the health risks of FGMC, the human rights violations it entails, and the stories of survivors can spark conversation and motivate communities to change. Television dramas, documentaries, and films that address FGMC can also be powerful tools for raising awareness. By telling compelling stories that highlight the impact of FGMC on individuals and communities, the media can humanize the issue and create empathy for survivors. Moreover, media campaigns that include messages of hope, healing, and empowerment can inspire individuals and communities to take action and abandon FGMC. Digital media, especially social media platforms, offer an unprecedented opportunity to reach global audiences. Activists, organizations, and individuals can use platforms like Twitter, Facebook, and Instagram to share information, organize campaigns, and mobilize support for the eradication of FGMC. Hashtags such as #EndFGM and #StopFGM have already gained significant traction, helping to build a global movement that advocates for the rights of girls and women. Social media also provides a platform for survivors to share their stories and experiences. Survivor-led campaigns and personal testimonies can be incredibly impactful in breaking the silence surrounding FGMC and encouraging others to speak out. By amplifying the voices of those who have lived through FGMC, social media can help to shift the public perception of the practice and create momentum for change. The role of education and international cooperation in ending FGMC. As mentioned earlier, education plays a central role in preventing FGMC and fostering long-term cultural change. However, education efforts must be comprehensive and well-coordinated at both the national and international levels. National education systems must incorporate human rights education and awareness about FGMC into their curricula. Additionally, programs that engage both girls and boys in discussions about gender equality, sexual and reproductive health, and women's rights are essential in creating a new generation of advocates who will reject harmful cultural practices like FGMC. International cooperation is also critical in the fight to end FGMC. Efforts to eliminate the practice require coordination between governments, international organizations, NGOs, and local communities. These partnerships can facilitate the sharing of knowledge, resources, and best practices, allowing countries to learn from one another and scale up successful interventions. Moreover, international organizations such as UNICEF, WHO, and the UNFPA must continue to support countries with the technical expertise and funding needed to implement effective anti-FGMC programs. By prioritizing FGMC in global development agendas, the international community can help ensure that resources are allocated to eradicate this harmful practice. A collective global effort, ending female genital mutilation, cutting, FGMC, is a complex and multifaceted challenge that requires the concerted efforts of governments, international organizations, local communities, and individuals. While the road to abolition is long, the momentum for change is growing. Through legal reforms, education, media campaigns, healthcare improvements, and the engagement of religious and cultural leaders, progress can be made. The fight against FGMC is not only about saving lives, it is about protecting the rights and dignity of women and girls worldwide. With continued dedication, collaboration, and a shared commitment to ending this harmful practice, we can work toward a future where FGMC is no longer a threat to the health, well-being, and futures of millions of girls and women. Promoting comprehensive legal and social protections for at-risk populations to effectively end female genital mutilation, cutting, FGMC, legal frameworks must go beyond banning the practice. They must also ensure that girls and women at risk are afforded the full protection of the law. It is essential for governments to implement comprehensive legal protections that safeguard the rights of girls and women, particularly those in areas where FGMC is most prevalent. Laws against FGMC should be accompanied by clear legal definitions, criminal penalties for perpetrators, and strong enforcement mechanisms. In addition, policies must be developed that protect girls who are at risk of undergoing FGMC, including measures such as the provision of safe houses, protection orders, and legal assistance for those who wish to escape the practice. Laws should also be adopted to address the particular cultural contexts in which FGMC is practiced, ensuring that they are both effective and sensitive to the social dynamics of the communities they target. Moreover, governments must work closely with local law enforcement agencies to ensure that they are adequately trained to recognize and respond to cases of FGMC. Law enforcement officials should be empowered to investigate cases, apprehend perpetrators, and prosecute those responsible for carrying out FGMC, particularly when it occurs in clandestine or informal settings. Local police forces, particularly in rural areas, should be provided with the tools and training needed to carry out their responsibilities effectively. In addition to legal protections, there must also be strong social protections in place for girls and women affected by FGMC. This includes access to education, healthcare, and social services that support their well-being and integration into society. Survivors of FGMC must be able to access services such as counseling, rehabilitation, and economic support to help them rebuild their lives after undergoing the procedure. Furthermore, creating an environment where survivors can speak out without fear of retaliation or stigma is essential for enabling communities to address the issue in a transparent and supportive way. Strengthening support systems for communities. Facing FGMC communities where FGMC is practiced often face significant challenges, including poverty, limited access to education, and the erosion of social structures. For these communities to abandon FGMC, there must be a comprehensive approach that addresses both the immediate needs of individuals and the broader social determinants that enable the practice to persist. One of the first steps in this process is to ensure that families have access to economic support, as financial insecurity is one of the driving factors behind the continuation of FGMC in some areas. Families often view the practice as a way to secure their daughters' futures through marriage, particularly in communities where marriageability is closely tied to the practice. By providing financial incentives, such as scholarships for girls to attend school or microloans to support small businesses, families may be less inclined to adhere to the practice. Additionally, community support networks must be developed to provide alternative pathways for families to achieve social acceptance without subjecting their daughters to FGMC. These networks could include mentorship programs for young girls, training for women on their rights, and community-based initiatives that promote gender equality and women's empowerment. These initiatives can help shift attitudes and perceptions about FGMC, empowering communities to abandon the practice on their own terms. At the same time, efforts must focus on creating supportive environments for girls who are at risk of FGMC. Schools, healthcare providers, and local organizations should collaborate to ensure that at-risk girls have safe spaces where they can seek protection, guidance, and support. These safe spaces can provide counseling, legal advocacy, and practical resources to help girls escape the pressures of their families and communities to undergo the procedure. Furthermore, strengthening the involvement of men and boys in these community efforts is crucial. Many anti-FGMC campaigns have successfully included men and boys in the dialogue, helping to challenge gender-based norms and perceptions. When men and boys take a stand against FGMC, they can help create a collective voice that supports the protection of girls and women from harm. This approach encourages men to view gender equality not just as a women's issue, but as a broader social issue that benefits everyone. Addressing the intersectionality of FGMC and other forms of gender-based violence. FGMC does not exist in isolation. It is often part of a broader pattern of gender-based violence that women and girls face. In many communities, FGMC is linked to other harmful practices, such as child marriage, domestic violence, and trafficking. These practices often intersect and compound the vulnerabilities of women and girls, making it essential to address them simultaneously in anti-FGMC strategies. To effectively tackle FGMC, it is important to adopt an intersectional approach that recognizes the multiple layers of discrimination and violence that women and girls face. This means addressing the root causes of FGMC, such as entrenched patriarchy, poverty, lack of education, and limited access to reproductive health services. In addition, efforts to end FGMC must consider other forms of violence that women and girls experience, providing a holistic response that includes legal reform, support for survivors, and community engagement. Child marriage is a practice that often overlaps with FGMC. In many countries, FGMC is performed as part of the cultural preparation for a girl's marriage. Tackling child marriage can, therefore, be an effective strategy in the fight against FGMC. Legal reforms that raise the minimum age for marriage, along with education programs that challenge the cultural and economic reasons for child marriage, are vital for protecting girls from both practices. By empowering girls to stay in school, delay marriage, and make decisions about their own futures, society can reduce the incidence of both FGMC and child marriage. The intersectionality of FGMC with other forms of gender-based violence underscores the need for a coordinated, multi-pronged approach to tackling these issues. Governments, international organizations, and civil society groups must work together to create comprehensive strategies that address the various forms of violence that women and girls face. This approach should integrate legal frameworks, education, healthcare, and social protections, ensuring that women and girls are not left vulnerable to multiple forms of abuse. International advocacy, a unified voice for change. One of the most powerful tools in the fight to end FGMC is international advocacy. Global networks and organizations working on women's rights and child protection have played an instrumental role in raising awareness about the dangers of FGMC and mobilizing action to eliminate it. However, the challenge remains immense, and sustained global efforts are needed to keep the issue at the forefront of the international agenda. International campaigns, such as the United Nations initiatives to end FGMC by 2030, have helped to galvanize global attention and spur action at the national level. These campaigns provide governments and organizations with the framework and resources needed to tackle FGMC within their countries. Additionally, international advocacy allows for a collective effort to hold governments accountable for their commitments to eradicate the practice, ensuring that resources are allocated and actions are taken to protect girls and women from harm. International partnerships between governments, non-governmental organizations, NGOs, and the private sector are also crucial for mobilizing the resources and support needed to end FGMC. For instance, the Girl Generation, a collective of NGOs and organizations focused on eliminating FGMC, has worked with communities to advocate for change and provide funding for local initiatives. Such partnerships can amplify the message, broaden the scope of action, and provide the financial backing necessary to scale successful programs. The power of a unified global voice is critical in challenging the practice of FGMC, and international advocacy must continue to pressure governments to take stronger, more effective actions. This includes raising awareness through media, pushing for legislative reforms, and supporting the work of grassroots organizations that are already making a difference on the ground. Leveraging technology for long-term change. Technology is rapidly reshaping the way social change happens across the world, and the fight against female genital mutilation, cutting, FGMC, is no exception. The advent of digital platforms has allowed activists, organizations, and governments to amplify their efforts and reach vast audiences, including those in remote areas where FGMC is most prevalent. Social media platforms such as Twitter, Facebook, and Instagram have been vital in spreading awareness and encouraging people to join the movement to end FGMC. By using viral campaigns, hashtags like #EndFGM, and powerful survivor stories, social media can engage millions of people in the fight against FGMC, creating a global community committed to ending the practice. Furthermore, mobile technology offers opportunities for girls and women in rural or underserved areas to access educational resources, healthcare services, and support networks without geographic barriers. Online platforms can also serve as a tool for mobilizing grassroots efforts. Activists and organizations can use these platforms to organize virtual rallies, fundraisers, and awareness campaigns, empowering individuals and communities to take local action. Online petitions and petitions via mobile apps can serve as pressure points for governments to enforce anti-FGMC laws and enact further reforms. Moreover, technology can play a role in documenting and monitoring the progress of anti-FGMC efforts. By collecting and analyzing data through digital tools, governments and organizations can track trends, assess the effectiveness of interventions, and identify areas where more attention is needed. This real-time feedback allows for agile and informed decision-making, which is critical in addressing a practice as deeply rooted as FGMC. Advice to African leaders: a call for stronger action. As the global community intensifies its fight against female genital mutilation, cutting, FGMC, African leaders must take a leading role in eradicating this harmful practice from their societies. The statistics are clear. FGMC contributes to significant preventable deaths, health complications, and psychological trauma for millions of women and girls across the continent. The practice is not only a violation of human rights, but also an economic burden that affects national development. Therefore, African leaders must prioritize the abolition of FGMC as an urgent national and continental issue. Firstly, African leaders must enforce stronger laws against FGMC and ensure that these laws are implemented effectively. While many countries have criminalized the practice, enforcement is often weak, especially in rural areas where FGMC is most prevalent. Law enforcement agencies should be equipped and trained to act swiftly and fairly in prosecuting those who engage in the practice. Leaders must ensure that there are severe penalties for perpetrators, as well as protection for girls and women at risk. Secondly, leaders must ensure that education about the dangers of FGMC is integrated into the national curriculum. Young people must be educated on the harmful effects of FGMC and be encouraged to challenge traditional gender roles that perpetuate the practice. Education should also include messages about sexual and reproductive health, human rights, and gender equality, which are fundamental to ending FGMC. Additionally, African governments must work with local communities and engage traditional leaders to promote alternative rites of passage that do not harm girls. These leaders often hold the power to influence cultural practices, and their support is crucial for community-wide acceptance of alternatives to FGMC. African leaders should also allocate more funding to initiatives that address the health, education, and empowerment of women and girls. Investment in healthcare services to treat FGMC-related complications, provide mental health support, and prevent the practice will pay off in the long term. By prioritizing gender equality and women's health in their policies, African leaders can set the foundation for a more prosperous, equitable future for the next generation. Lastly, African leaders must commit to collaborating with international organizations, NGOs, and other governments to fight FGMC. A united global approach is necessary to tackle this issue comprehensively. Leaders should use their influence to ensure that African countries work together to eliminate FGMC, sharing resources, knowledge, and successful strategies for eliminating the practice. Summary of key messages. Ending female genital mutilation, cutting, FGMC, requires a comprehensive, multifaceted approach that involves legal reform, education, community engagement, healthcare improvements, and international collaboration. The scale of the harm caused by FGMC, including preventable deaths, lifelong health complications, and psychological trauma, makes it a public health and human rights crisis that must be addressed urgently. Key actions to combat FGMC include 1. Strengthening legal frameworks and enforcement. African governments must enforce stronger laws against FGMC, ensuring that perpetrators are held accountable and that at-risk individuals are protected. 2. Community and cultural engagement. Local communities, religious and cultural leaders, and men and boys must be actively involved in the fight against FGMC. Community-led initiatives are crucial for changing cultural norms that perpetuate the practice. 3. Education and awareness. Education about the dangers of FGMC should be integrated into national curricula and community outreach programs, empowering young people to reject harmful practices and promoting gender equality. 4. Healthcare and support services. Strengthening healthcare systems to address the needs of FGMC survivors and providing support services for girls at risk is essential for mitigating the practice's long-term effects. 5. Global cooperation and advocacy. International organizations, governments, and NGOs must work together to raise awareness, provide resources, and hold governments accountable for their commitments to end FGMC. African leaders have a crucial role to play in leading the charge against FGMC, ensuring that their countries adopt and enforce policies that prioritize the health, safety, and dignity of women and girls. With commitment, cooperation, and sustained action, FGMC can be eliminated, creating a safer and healthier future for millions of women and girls across the African continent. By prioritizing gender equality, strengthening laws, and investing in education and healthcare, African leaders can ensure that FGMC becomes a thing of the past and that future generations of girls grow up free from the threat of this harmful practice. The time for decisive action is now. Thank you for watching The Bold African Voice, BAV. We hope this video has opened your eyes to the urgent need for action against FGM in Africa. Remember, change begins with awareness. Share this video, leave a comment, and hit the subscribe button for more in-depth discussions on the issues that matter. Together, we can make a difference. Stay tuned for more critical analysis and bold conversations. Until next time, let's raise our voices for those who cannot raise theirs.